Hello, good afternoon to all my friends, ladies and gentlemen. Okay, happy again to meet every one of you here in our Facebook Live. So on every Wednesday, we will be having a chance to meet everyone online. So to answer all of your concerns, related to beauty and also health. So again, thank you very much for those who are joining us. Yeah. And I'm Dr. Jeff from Revival Clinic. So today we will be talking about another very interesting topic. So the title here you may see on the screen called How to Be More Beautiful Than Your Daughter. Okay. So you want to be more beautiful than your daughter, probably you need to make yourself young, and also energetic, and also the overall looks should be as good reserve as your daughters. But anyhow, okay, today our main topic talkings actually will be more on fillers, okay, onto how it helps into our facial rejuvenation, keeping our beauty, keeping our looks as young, and also looks young. When you have any facial expression, you also looks young. Yeah. So it's not only on the static mode, but it's also matters on the dynamic modes. Okay, means when you're not doing facial expression like this, you are looking young, and when you're doing facial expression, when you're angry, whatever, you still looks young. Yeah. So this is what we meant by proper filler rejuvenation techniques. Which is a medical grade advanced techniques of filler rejuvenation, and it makes you young and natural at the same time, so that you can be even more beautiful than your daughter. So ladies and gentlemen, okay, I welcome every one of you. If you have any questions, you can ask us here, and today I make it simple and clear for you. So let us begin. Okay, fillers, first of all, before we talk about fillers, okay, today's my idea here is to let you understand more about filler. If you would like to reserve or maintain your looks, I would say most likely you may not really able to run away by filler choice. The reason is because filler is to fill back a little bit of volume on our face, and the volume loss is one of the significant factors of aging. So meaning to say, when you want to reserve your aging face, you need to tackle the problem of aging face. So the main problem of aging face, one of the main problem is volume loss. So if you do not replace the volume, you will not do the best, or hit to the point of your facial rejuvenation. So if you want to have facial rejuvenation, you need to have something to revolumize, and this filler is the one that do for revolumization. Okay, so simple to say lah, when you are like getting older, your face lost volume. Those volume loss will make your face looks flat, saggy, droopy like this. So we need to understand which area lost volume and how much, uh, where the level. Okay, and if you figure it out, when you inject fillers back onto that particular space, then you are rejuvenating your face. All right. But before we further on, you see, most of the time there are many different questions or frequent asked questions about fillers. So I listed down as 10 most frequent asked questions here for our discussion today. So first of most common questions asked is like, oh, is filler same as Botox? Okay, I will explain one by one. So, and the frequent asked question is like, oh, any side effect? And also, will I looks weird after the filler injection, or will I looks weird? My facial will looks weird in the future. These are the concern. Okay, all right, and frequent asked question about fillers treatment. And the result not lasting one, right? So no worth it doing, right? So this is also another frequent asked question. And once you start injecting fillers, you need to inject again and again. So this is also another very frequent asked concern. And is the filler material something toxic, dangerous to the body? Okay, also another very important questions and concern. And do the face has a effect of lumpy, or the filler run here and there, so they're kind of very unnatural, very vain kind of looking. So is that so this is also part of a frequent asked questions. Will I have allergies after filler injection? I got swelling lah, whatever. So would it damage the skin, whatever? So it's also a frequent concern. Painful, whatever we talk about fillers, it involves injection. So people who never do injection or sort of like afraid of needles may worries, whether is it a painful procedure, right? And also another thing is, after fillers, how long is the downtime? Would I get swelling, bruises, which I cannot afford to bear with it for at least more than 2 days or 3 days or 1 week, things like that. So these are the things that frequent ask. Okay. Why I'm spending my time today here is to explain to you all these answers and questions so that you have a proper understanding. It's not to sell you anything, it's not to convince you anything, but to let you have a proper understanding what is fillers, what is in and out, all the frequent asked question about fillers. Eventually, decision is still on you. If you would like to choose filler, at least you get to understand better and you do it in a confident way. If you understand the whole thing, if you still feel not comfortable, then leave it out. Don't choose it, right? Eventually, if you understand all together, you will understand filler actually is a safe techniques of safe treatment if you do it right. Okay, so let's begin and our topic one by one. Okay, first commonest asked question is filler send me Botox. This one I have to emphasize that again and again to every one of you. Filler is not same as Botox, right? So I listed down here. Fillers is to target some volumization of what your fat on your face lost. Okay, so it's to replace back the volume. Botox is different. Botox is totally different thing to say. It's totally different. Cannot compare apple to orange. Okay, Botox is Botox by itself. So it is to target on our facial muscles. When we are aging, our muscles will become hypertonic or sort of like very strong movement, so it causes wrinkles. So Botox is to reduce the muscle movement, reduce wrinkles. It may have correlation between volume loss and muscle movement. Meaning to say, if you have aging, your volume loss will causes the space of your face will have a bigger space, more looser space to move, and your muscle becomes stronger because of this. Then that's why you have wrinkles. So injecting Botox is to reduce the muscle movement, but it do not replace volume. Okay. But if you do fillers to replace volume, it reduces the space that muscle moves. So it can also reduce the wrinkles indirectly, but it's not straight directly as compared to Botox. So these are the differences. Okay, please get it right. If you're not sure, not understand still, you may ask your question, type your question down here in the comment and I will answer one by one. Okay. So this is very simple. Even 5 years old boy should be able to understand a little bit on this. All right. Okay. So this is the different filler and Botox, totally different. Please make sure you get it correctly. Get it right. All right. Okay, so filler and Botox, as simple as that. Okay, got any side effects? So I put it here on my slides then and now. Okay, there are many side effects concerned. Okay, if you say pains, swelling, lumpiness, or shifting, fillers moves everywhere, shifting, it was side effects due to DAN, meaning to say old techniques of injection. There are still many practitioners using old techniques of injection. So and also certain material of products which is not being studied thoroughly. Then if you do it in a way where it injecting into certain place on your face and it congested and it may cause swelling, or over injecting it may cause swelling. So side effects is potential, but how to avoid the side effects mainly is to make sure that the practitioner get to know the products in and out, very familiar, very sort of like experience using that particular products, and that product is sort of like predictable in terms of the response and outcome after injection. And the practitioner should be fully aware or fully experienced on what likely the outcome after injection. And also during injection, how much of the volume to control, and at what space, on the face it is injecting. So these are the things now, okay, that we are doing to prevent those side effects. Okay, those side effects is like after you injected, probably you feel lumpy, not even, asymmetry, or the lines is like something not right, and you do facial expression, it looks weird. So those are the things, then side effects, on the older version of techniques. So newer version is more scientific proven, more medically, studied and also proven. So it is definitely safer, much more safer, much more predictable, much more confidence in terms of the treatment method, safety, and also much more expectable outcome. So the evolutions, the improvement of the understanding, knowledge, experience, and also the use, of the product in the market, and also the practitioner experience are all the matters, to make sure that you got the least side effects and you optimize the result at the same time. Okay, so the main concern here is actually before, then, and also now. Okay, so of course now if you are looking for a practitioner doctors, okay, so you must make sure that like what we do, we make sure that we get to know about the product long enough. Okay, like for example, I've been injecting a filler brand, for many years, and the only brand that I'm injecting and the only material that I'm injecting which already enough for the whole face, and that is what I'm making sure that I fully experienced, fully aware, fully predictable what will be the material do on your face, on the forehead, on the temple, on the cheek, on which area of the face. When I inject this amount, what will be the likely response? So will the response being controlled, and also with the number of volume injected? These are all our sort of like fundamental things to make sure before we introduce a product to you or do the treatment for you, right? So then and now is the matters to concern. Okay, so if you ask us, okay, got any side effects? Okay, so simple to say, if I'm injecting, then no side effects. If you are doing it without a proper experience or methods, probably you are risky yourself with certain side effects. Okay, so at the end of the day, means filler still potentially got side effects if you don't do it right. But if you do it right, it definitely is safe enough, right, to be done in worth it. It's a worthy ways to do it. Right? Okay, so that's the thing. All right. Will I look weird, okay, after injection or in the future? Okay. Same again. Filler treatment is a very tricky part where it actually solely dependent on the practitioner's skills and also assessment and also the artwork, the work that is done. If for example our face, on the cheek, let's say, okay, our apple cheeks here, everybody is different in terms of structure, size, volume. So it has to be very individualized in terms of the planning, how much of volume to be injected, and this volume would it be doing the best effect, not too much, not too less, just nice. So these are the most important fundamental things to make sure when we before any fillers done, because if you do it right, just right, so the result will be very nice, very beautiful, and it doesn't overstretch your facial compartment and ligaments or fascia. In the future you will still looks good, as natural as you are, as beautiful as you're supposed to be, and you will not look weird. Okay, there is possibility when after a filler is done and years later a patient looks weird, okay, due to two commonest reason. First, if you over injected, at one space is supposed to be not more than 0.7 cm, for example, 7 mils, for example, or certain amount, let's say 1 mil, for example, but you injected more than that at that particular confined space. So that will cause an overstretch of your ligaments, and it actually makes your face even saggier after your fillers loose. So these are the thing. And then the second thing is material used. If the material used is too heavy or too concentrated for that particular space, then you maybe will cause your facial volume to be over swelling, over stretch, and in the future it will distort your overall dynamic function over this around surrounding area of the filler injected. So this will cause you to have some sort of weird looking in the future, because if you overstretch, then your smiling will be like that. In the future, your smiling also a bit different. So these are the things that it has the potential. Okay, but how to prevent it? It's a fundamental things. That's why we do encourage fillers treatment or injectable treatment only done by a trained doctors or trained practitioner, and of course to be even better, not only trained but also experienced and also very well trained and also well experienced in terms of the product injection, and the assessment before injection is the fundamental important, fundamentally very crucially important. Yeah, everything starts from planning, assessment and planning. Yeah, if the assessment and planning was done very well, the rest of the work will be carried out very successfully. Yeah, so regardless whether the skill is very good or not, but if the person had very good skill but the fundamental assessment and planning was not carried out properly or in the expert way, then no matter how you inject, also it will come out to be something not right. Okay, so again, yeah, now and the future, if you inject just right amount of dosing of fillers and also proper selections of filler types onto a proper compartment of facial compartments space, then you will look perfectly natural, nice, more beautiful, younger than your daughter, and you will definitely will not look weird even now or future. Okay, so these are the concerns. Okay, lasting result. Okay, sometimes we may be a bit greedy, or we may be hoping that, okay, so after we do this fillers injection, it lasts forever, so I do not need to suffer for second time, or I do not need to suffer for even subsequent time. Very sorry to say, even let's say if you don't do anything, your beauty also do not reserve by itself. Yeah, you will also age further. Okay, so fillers is a treatment that we use it for the idea, for the purpose of delaying aging. Meaning to say, if you're starting to have aging features problems, fillers done can slow down the progress of your aging. If you don't do any fillers or any treatment, then your aging carries on. Yeah, you will look older and older years by year. But if you do fillers, is stop the further progress of aging. It may reverse certain amount of your aging, makes you even younger than your age. Okay, so this is the purpose of using filler, and of course, the result is not forever. Yeah, it will never be lasting forever, but definitely it may last you at least certain amount of time. Okay, so most of the time, fillers selections using hyaluronic acid will last about 1 to 2 years. Yeah, most of the time 1.5 years, 2 years are the commonest outcome that you can get. Okay, yeah, so that's why don't ask for lasting result. If you are looking for filler treatment, don't ask your doctor to give you forever lasting result. Don't ask this question also, because no point. Yeah, you understand the facts, but then why you ask again? Okay, nothing is forever on this earth. Okay, even if you buy a house, a car, nothing is forever like that. It will change also. You will age. Your car will be old. Your house will be old. So you need to sort of like refurbish it also in the future. Same goes to a human. Yeah, not only your face, even your health also. Nothing's last. Okay, so this is life. We have to accept the truth, but how we go ahead with it, how we go along with it. Okay, so we maintain. Okay, of course, maintenance we have to be clever lah. We have to have a strategy. Okay, so we must do it right, do it correctly, and maintain in the minimum cost that needed. Okay, there will be something smart. All right, so that's why I say how to make your result better, Rustin. Yeah, you must be smart, using some amount which just nice enough, not too much, not too less, just nice. Everything will be just optimum. Okay, yeah. So what and where? Okay, so most of the time when you do fillers, we will assess which area of your face that already have significant volume loss that need to rectify now, and also we also will assess and see which area of your facial volume that already having some volume loss but may still observe and maybe can plan for replacement or fillers in the future. So always upkeep your facial volume assessment so that you know where you should do now, cannot wait further or else the aging already there, and where are the space on the face that actually starting to have but not yet necessary to treat. Then you can observe when it's necessary to treat, then probably you have to treat. Okay, so then you do it right, do it correctly. Okay, and you're optimizing the results in the minimum cost. Okay, so these are the thing. Okay, these questions need to keep injecting again and again. I keep on hearing people. The understanding is totally wrong. Okay. So first of all, our face age by volume loss. So if you say we need to again inject again and again, it's not due to filler itself. It's just because of volume loss itself. It's keep on happening, keep on losing. Yeah. But the thing is, the funny thing and the great thing is, we find after fillers replacement and rejuvenation, your volume loss speed on the face actually slow down overall. Yeah. So that actually reduces the further progress and speed of aging. And if you need to inject, it's just to maintain or enhance even more on your facial look so that you will look even more beautiful or nicer, younger than before. The second, third session, maybe you will look even younger and younger. Yeah. And also to tackle certain areas that already having significant, just now as I say, maybe now you have some volume loss but not significant yet, you may observe to treat, but once you reach maybe another few years down the road, then the loss at a particular area become more significant, then you need to treat. Okay, so these are the ideas properly, proper ideas that you need to get it right, or else it's not just keep with this mindset saying that you need to keep injecting again and again, then you are wasting money or you are spending a lot of money. Not in the way. Yeah, if you're not doing right, for example, if you have significant volume loss and you do not rectify it and you do something else, that's even wasting money. This is why my point of view, right? Okay, let's see some questions from the floor. Okay, Sherin is asking, any downtime? Okay, basically, fillers injection on the skillful, experienced injectors, you will have very minimal downtime. Most likely, just small injection dots, which will only last you 1 day. Some pain, stretch, tight feeling, probably for first 1 or 2 days. Okay, very minimal risk of bruises. Okay, minimal swelling, feeling, not obvious, but you will feel it, that kind of downtime. Yeah, so very minimal actually consider after filler injection. Judy is asking, have seen the lady friend, her cheek looks weird. Of course, cheek is the trickiest part to do fillers because it has 1, 2, 3, 4, 5, more than 5, easily. 1, 2, 3, 4, 5, 6, 7, easily 7 injections technique to target different zone, different layers, different levels of volume loss. And how to get the volume loss? How do we know which area of your volume loss? We have to assess your facial expression, your structure, your bone, and then we know where is your volume loss. Yeah, it cannot be like just cheek, you inject 1 cc, that's all. Inject 1 cc into which space? Deep, which area, left and right, inner, outer, upper, lower. We have to get it right. Okay. Yeah, sometimes cheek we inject 7 areas, each area differently. Some area need 0.3, some area need 0.4, some area need 0.2, some area need 0.5, and in a combination different texture of fillers as well. Yeah, to get the whole thing naturally back to its original or younger sort of like condition. So it's quite complex, but if you do it right, the result is very nice. Yeah. So okay, Judy, your friend probably just done under a very simple injection, that's all, and bump up everything. So that is over stretching. I'm my advice you don't do. If you do it, you looks weird. In the future, you looks even weirder. Yeah. So Judy Tan say her cheeks so high and lips so thick. Of course, these are the wrong techniques. Okay, wrong beauty concepts as well. Okay. Okay, can see she does something. Yeah, of course. Even though you are not, I believe probably you are not a doctor or not a practitioner in aesthetic, but by a layman looks also you can see something wrong. Means the job was not done professionally. Professionally means we have to inject fillers onto the volume, onto the face where you supposed to have the volume since young, but you lose it because of aging. So we are replacing the volume back so that you look young. But we don't want to be over injecting. We don't want to over stretch. We don't want to too over volumizing. No point. Okay. We want it to be younger, better, looks more beautiful, but in the natural way, which you supposed to have the volume, but you lose it just because of aging. So we replace back, then it prevent your aging. So as simple as that, yeah. So get the idea right, then you will be able to understand better and the reason of proper and safe injection of filler, and then you can use it in a confident way. Okay. So again and again, we need to inject filler. No, yeah, but if you do it right, then the maintenance will works well for you. Okay. Toxic to body. I think these questions was tended for Botox. I think, yeah, filler itself with this technologies is completely safe. Yeah, and he has more than almost not 20 years, also at least 15 years to prove the efficacy and safety database in human use. Yeah, more than millions and millions of people has been injecting fillers in certain brands who has a data collection since 15 to 20 years back. So the data has already big and confidence enough to again says, yeah, the hyaluronic acid material of fillers do not cause any potential toxics to the body. Okay. Yeah. So lifespan and durability. Okay. So no, I mean toxics to body, as long as it does not have a toxics, okay, or something material harmful, then it should not, okay, be worried about. Okay. I think the lifespan or durability is in the sense of if you use something else, not like hyaluronic acid, maybe something else. So the material may last longer, the lifespan of the material may last longer, and then it probably will release some toxic. Is it something? Okay. So no matter how, okay, so I will recommend only hyaluronic acids fillers choice of use now. Okay. So other than that, okay, unless the doctor is experienced enough, good enough, and the material you can use it in the proper way, then okay, in the sort of like control manner lah. Okay. So something to be injected on our face. Sometimes we want something to be authentic, yeah, really something quality, yeah. So it do the nice job and prevent use from any side effects. So make sure the product used is also a authentic products, okay. Yeah, so you purchased and you know why it's injected. Okay. Fillers or cause lumpy or shifting in place. Okay, actually, this is a potential condition that a person's after filler injection will face. But if we do the techniques of injection right, proper selections of the material, and also proper injection of a space, and also proper exact accurate amount of filler injection, then you can confidently say filler will not shift place and it will cause lumpiness problems for the patient. Okay. So again, this is still applies back or reverse back to the techniques and the experience of a doctor who did fillers. Yeah. So sometimes you may think, oh, is it so troublesome, so vain, yeah, because we want to have some beauty, but then you are like also have the dealing with all these kind of potential side effects. Actually, it's not this way. Okay, so the responsibility for a professional doctors is to make sure he or she has the capability, yeah, and confidence, skills to deliver the fillers and target and solve your problems, okay, without bringing you any side effects. And even better is to prevent you from all these side effects. So these are the things to make sure, okay, for a skillful doctors or practitioners lah. Yeah. So you need training, you need long experience training, yeah, to be able to do so. Okay. Same apply, for example, yeah, doctors or surgeon. Okay, if you have a issue to treat, yeah, you need some operation. Okay, so the doctors and the operation surgeon is very important, yeah, so that the surgeon must have to have the skills, yeah, and also must has to have the knowledge, and also every products that he used during the surgery also potentially cause some side effects. Seems apply like it's filler, but the thing is, it's the doctor's responsibility and works to prevent all this. Okay, yeah. So nevertheless, of course, if you are selecting a non-doctor, so non-doctor may not have even any proper training or experience to really, yeah, able to figure out what potential side effects you may have and how to prevent it. So that's why we hear a lot of stories in the public complaints about fillers complications. Yeah, and you probably asking all these questions related to fillers because you saw all this on the news. So what we need to be sure as a consumer is we must make sure that we are doing our fillers under a skillful hand. Lor. That's all. All right. So and under professional trained doctors lah. Okay, for your safety and for your benefits as well. Okay. So filler will not cause lumpy, okay, if you properly select the material used, injecting in the proper and exact space that you want, and the amount of injections should be just nice, not too much, not too less. Okay, what I'm talking here, all these are actually already proven, meaning to say there are many studies prove that. Okay, filler lumpiness are due to over injection or non-proper injection space, and the material used choice was not correct. Yeah, so doctors who are trained are usually trained on this. Whenever we look at a person's face, we know how to choose appropriate products for the person. Yeah, if you are injecting on this space, or in this space, or this space, with which product should be used on each respective space, and then which space on the face that we need to inject. So we simple to say deep, very deep, or middle, or this one. There are many layers in terms of scientific terms. Maybe you may confuse, but simple to say is like deep, very deep, middle, or surface, things like that. Okay, yeah. So the angle or the shapes of the space maybe also a bit different. Some rectangular, some could be a little bit of oval shapes, things like that. We need to get the space, yeah, imaginary boundary, right? So when we inject completely smoothly inside the boundary, so that it would not over concentrated at one space, and the amount delivered should be just nice for the space to volumize and to lift the ligaments and fascia, so that it serves the purpose of lifting and rejuvenation, and it's not overdoing and stretch out the ligaments, stretch out the fascia, then the face feels even heavier. So we don't want this, but we want something proven, something effective, something safe to be done. Okay. So facial allergics, there are some cases after filler injection, even with hyaluronic acid, they have some facial response like some swelling, some sort of like pain, redness, feeling. Okay, is it really a kind of allergics? Okay, so there are some studies shows that most of the cases are not due to real allergics problem, because most of the time it resolves by itself or with some medication, then it's done. Because if it is allergic, as long as the material is still there, it will be allergic forever. So it is not logic that the patient has some response, but then after some time it resolve, but the filler is still within the face, so it couldn't be allergic, right? Okay, in that sense. So Is it really allergic most of the time? No. Okay. Infections chance possible if you have sinus issue, allergic rhinitis, nose allergic, sinus infection, or oral cavity, then sort of like caries, and then probably it cause you to have some triggered infections after the filler injection. Yeah. Then hormonal effect, yes, especially in ladies, yeah, during menses and during the time of hormonal imbalance, then you may have some facial swelling, bruises easier than the usual time. Okay, yeah. So the hormone disturbance kind of feeling effect here. Water retention, yes, certain ladies who have facial skin which is more fragile, looser, and more opening space inside the interstitial area. So that will cause the facial to get some easier mode of water retention after filler injection. Okay, so also not due to facial allergic, but on this kind of other matters lah. But all these are sort of like solvable lah. So it's not something permanent, something dangerous. Okay, yeah. But doctors must know. Okay, to know how to handle all this. Painful. Okay, basically filler injection again, yeah, is supposed to be injecting into a proper like fascia and fat compartment, and this facial layer are usually less painful, not so sensitive. So meaning to say, if we are injecting fillers into these spaces, then usually is considered quite comfortable. You will feel something but not painful. So eventually, meaning to say, fillers injection is almost not painful, but with the correct techniques and proper methods lah. Okay, so this is the things to pay attention or to know. Okay, swelling, bruises, downtime. Yeah, when, why? Usually some downtime is there. Yeah, sometimes injection you cannot 100% say you will not have bruises. So, but if you do it right, okay, proper skills, introduction of needles, yeah, will make sure the fillers is done without much injury on the skin. Then it minimize the bruise. Okay, swelling. Again, if it is properly distributed in the fascia and the spaces inside the fat, it should not be concentrated, and the swelling usually is minimal. You will feel some tightness, in fact, but not really like obvious visible swelling. Downtime, if you say downtime, basically it has minimal downtime on external look. You will have, unless some bruises, usually you wouldn't have any significant much swelling, weird feeling, weird swelling, or extensive swelling kind of thing. Yeah. So usually downtime is in generally about 2 or 3 days. Yeah. Okay. So some may extend about 1 week. Yeah, with some downtime of feeling pain, not really saying pain, but tightness, yeah, after the filler injection. Yeah, tightness about 1 week. Okay, so these are the potential. Okay, so ladies and gentlemen, yeah, fillers is something we can't avoid, because you can avoid like if you choose to, but if you really want to improve your facials look aesthetically and more beautiful, yeah, we need to tackle volume loss factor on the face. So volume loss, yeah, is a major and a must, okay, happening, yeah, problems, or one of the factor that happens to everyone when aging. So definitely everyone's when aging will have some volume loss. You cannot deny volume replacement if you want to rejuvenate your face. Okay, unless you understand and you choose not to, then it's still okay to choose not to. But then certain area of aging due to volume loss, you may not be able to rectify it. Okay, so as simple as that, just to let you understand. Okay, so but wonder. Okay, a question from Judy Tan. Wonder how people can do it. In Malaysia, sad to say, there are still many untrained, even like non-doctors, yeah, who are offering fillers or this kind of injectables treatment to customers. So it's up to our right, yeah, our positions as a consumer, our rights to not to ask for treatment from these kind of untrained doctors, or this kind of sort of like non-doctors practitioners who are doing injectables. Yeah. So if it is non-trained doctors injectables, they supposed to have their scope of sort of like experts, okay, but not injectables for non-doctor, right? So I hope that consumer as our own, as a consumer, we ourselves as a consumer should have this proper understanding or knowledge to differentiate who's supposed to be the proper position or person that carry out this treatment for you, because you have all these concern behind your mind. Yeah, swelling lah, bruises lah, side effects lah, is it proper done lah, natural looking or not lah. All these are very serious and important concern that you need to pay attention to. So who can solve this problem, do the treatment for you, since the necessity is there to do a filler, then the concerns has to be rectified and also noted, right? So who will be able to do all this job and preventing all these side effects? Okay, so it's up to your choice. You need to you need to know who's supposed to be the proper person to do the carry out the job. Okay, so that is why I'm trying to deliver some message for consumers. Yeah, but for those who are already doing fillers, okay, so probably you feel more confident with the doctors or the person because of he or she having this kind of ability to prevent side effects, to properly done the job. Yeah, so means you got the person right. Yeah, if you don't have, then probably you have to find someone which has it. Okay, so that's the thing. So we must accept the truth lah. Filler is something is there necessary and it does carry out its own certain risks and potential of side effects. But we must have the experience and skills and knowledge to prevent it, and also at the same time able to fully optimize the use of fillers for our facial rejuvenation. Yeah. So one of the major important filler rejuvenation techniques is called filler estimation. So this is very important. We cannot say that, oh, I want to inject 1 cc, 2 cc, and you decide just because 1 cc costs you how much, 2 cc costs you how much. It's not in that sense, yeah. So if you are planning to rejuvenate your face due to some aging condition, yeah, so we need to assess how much filler that you need. Okay, it's not how much filler I want to sell you. It's how much filler that you need at the first place. Okay, if you need this amount of fillers, then no choice, you have to do it, or else if you're underdosing it, then probably you will not get the best result outcome. If you are doing more than that, if you say, oh, probably you need 3, but you want to say you want to do 5, not necessary. Why you want to bring some extra problems to your face? Since you need 3, means 3 is enough lah, right? So these are the thing. Okay, so filler estimation depends a lot on the age as well. Okay, on your age and your skin quality. Okay, and the facial expressions, yeah, some people you see when they are static mode, not doing facial expression, looks very beautiful, but when the person smile, it looks uglier. Okay, so that probably is because some volume imbalance, yeah, causing some imbalances of the facial dynamic. So it makes a person smile looks weird and also looks tired, looks even older when the person has facial expression. So these are the things that we need to estimate. To based on for your fillers volume estimation. And also, of course, for women and men, the beauty sense is different. So the filler injections and filler estimation volume also need to be sort of justified accordingly to the woman's expectation and men's expectation. And there are many more, but these are the fundamental factors we need to put into account whenever we're considering counting the fillers estimations volume. Okay, so volume estimation is very important. If you calculate the volume correctly, the more accurate you are, the better result outcome. Okay, and if you estimate it right, then you plans it. Okay, plans it like first step, second step, third step, where to inject one by one. Then you will be able to get your results as expected, as you want it to be. Okay, so these are the things. Okay, sharing some. I think today I prepared one questions only. One testimony only. One of the my stuff. Okay, so of course I do not enclose our customers' privacy here lah. So this is one of our. Okay. So this on the on your left or right, okay, you take it yourself, okay. So this is before, okay, this is after. All right. So if we feel the emotions effect after the filler injection, these are all solely filler injections, result before and after. This after, definitely she looks younger. Yeah, she looks more attractive overall. Okay, she looks more energetic, more, I mean, not so tired looking. She also looks more friendly, okay, more feminine. Definitely she looks better like all over, okay. But do you able to pinpoint where are the treatment done on the face? Okay, so can't, right? Yeah, so this is what we call it. Macam ada injection, but macam tak ada injection, but there is some improvement, and the result is quite natural. Yeah, so this is the sense of filler injection. Okay, that medically, sort of like medical way lah of doing fillers. Is not that sense of beauty way, very guessing way. Okay, it's more beauty and medical way of evidence-based way to do a filler rejuvenation. Okay, on the side view, okay, this is before, this is after. Yeah, definitely she looks much more sharper. The face looks, okay, not so saggy. The contour looks sharper, jawline also looks slimmer. Yeah, the eye looks bigger. Okay, the contour on the face, looks more harmony. More sharper looking, more attractive, more feminine look. Okay, more beautiful overall. Okay, another side also, if you look at the face, okay, the face also looks sharper, okay, firmer. Eye also looks better. Whole face also looks more balanced. She looks happier after the treatment. Okay, more beautiful, happier. Okay, more attractive. Yeah. So these are the results that we get. With the safety. Confidence in safety and efficacy. These are the results that we deliver to our patient. Okay, so all right, what else? Okay, so that's about it for today. So I hope that at least I give you some proper understanding for filler injection. If you do have some concerns about volume loss on your face, and you have aging issue and you want to rectify and improve, and you know that you need some filler injection, but you are worried and you are not sure whether filler is a good choice, and you are not sure what is filler, any side effects, I hope today's my presentations and discussion brings you some idea. Okay, if you are having some confused points that I mentioned just now, if you are confused or not sure with any points I mentioned just now, you can always type your questions here, or give us your message or WhatsApp us, email. Okay, so you can contact us through our contacts here, and let's and show you. So we are here based in Revival Clinic. Here our current address in Kota Kemuning. So you also can email us in revivaldoctor@gmail.com, or you can visit our website, www.revivalclinic.com.my, for more information readout. You also can directly call us or WhatsApp us through 017-781-5237. Get in touch with us. So if you have any more questions that you want to know, or if you want to make yourself assess whether you need fillers or not, or if you have done fillers before but you are not satisfied result, you want to reassess and see what really needed or what missed out. Okay, and probably you lost confidence with fillers, but you want to still try some fillers and give it another chance, so that probably fillers can do a good job for your best improvement on your face. Yes, you can always contact us. Or you have never heard about fillers, but you think filler is a good choice for you, you want to try and get to know first, you also can contact us. So many reasons behind. If anything related that you want to do fillers, and also you want to know about fillers, you are welcome to get in touch with us. You can call us, WhatsApp us. If you feel shy, you can email us. If you are not sure, you can drop us a message, and we can call you back. or you can visit our website to get to know a little bit more about what I mentioned just now. Or you can just walk in, step in, but we do not welcome walk in. Please make appointment. Yeah, so we don't want to make you waited too long. Okay, you can visit our clinic in Revival Clinic, Kota Kemuning. Okay, all right. So that's all about it today. Okay, very happy that I have a chance here to share my information and knowledge to every one of you. And my wish to every one of you is wishing you all looks happy, looks younger, and looks more beautiful than your daughter all the time. Okay, and wish you a happy Wednesday. And I see you again on next Wednesday, and we will bring you another interesting topic for discussion again. All right. Thank you very much. I'm Dr. Jeff from the Revival Clinic and see you again. Bye bye.